what is the element. Okay. In some studies, we'll have the multiple treatments. If you go for the oncology, we'll have some therapies and then some cycle-wise treatment. Okay. So in that case, what you will do, each and every cycle or each and every different treatment would be the one element. Okay, in that case, how you will differ this element and epoch? Okay, that is a different question that we will answer in the while working on the subject elements. Okay, for the subject elements, if you want to derive the subject elements, what all are the needs? You need the protocol, you need the trial element. Okay, you need the subject visits data set, and then you need the demographic data set, you need the disposition data set, and what else? Exposure. Yeah, you need the exposure data set. These are the things which we require to create the subject element data sets. Okay, subject element is a quite interesting data set. If you put it in the your CV, if someone will ask you, did you work on the subject elements? If you perform the subject element question properly, they'll easily understand this guy know everything. That is the utmost complex things involved in this here. So, okay, when it comes to the straightforward study design, it's okay. But when it comes to the crossover studies, okay, some adaptive design studies, it's not that much easy to create the subject element data. It's a very, very, very complex. Okay, so when it's adaptive designs and the most of the psoriasis studies would be the adaptive designs. Okay, so those cases it's a bit difficult to create the subject element data. Anyway, that is a different topic. We'll discuss detail in the future. Okay, so the next is the trial design. Trial design data sets, you know, right? The trial arms, trial elements, trial visit, trial summary, trial inclusion, exclusion criteria. So these are the things this covers. Okay, so you know, right, everyone. These are the trial domains prepared from the protocol. So while seeing the protocol, you should aware the things that what is going to done in the clinical trials. What is my arm? What is my visits? What is my element? Okay, so what are the particular parameters in the trial summary? Okay, parameters. Okay, so that you need to understand from the very beginning itself from the protocol. Relationship records. You know, right? Relationship yesterday when we discuss RelRec records. Okay, and the supplementary qualifiers. So these are the things. Okay, so the relationship also quite interesting data set. Some reviewers will need the relationship based on the particular disease and the treatments and the procedures and the finding about. These are the things is much required for the some of the specific studies to address the reviewers questions. Okay, yeah, these are the supplementary qualifiers, everyone you know. So when it comes to the any other information captured from the CRM, we'll create the one QNAM. Okay, so yeah, the study reference slide. Okay, these are the references the representing the study specific terminology used in the subject level data. Okay, so these are the bit new things that divide as identifiers. Okay, pharmacogenomics, which we are talking about the previously slides, right? Okay, the device study. So these are the study reference things. Okay, and then associate person also. When we called about associate person, as I said in the previous slide, okay, if we have the infant studies, we are going to create for the APDM, APMH, some associate person domains. So the variable roles, I think you all aware of the variable roles. However, but we'll go quickly. Okay. So the variable roles, there are 5 types of variable roles. So the basic identifiers and topic and timing and qualifier and role variables. Okay. So these are the things basically describe the variable roles. Okay. So that classification also will have the based on the code and the based on the role. So but these are the role-wise classification. Okay. But yeah, when it comes to these are the basic things from the SDTM. So if you go for any interview, okay, if you're having the 3 years, 2 years, and then the very fresher, so these kind of questions definitely will ask. Okay, so if you have the some 6 years, 7 years, 10 years experience, no one will ask these kind of questions. What is the SDTM and what is the identifiers topic? Even those experienced guy doesn't remember these things as well. So the going forward will forget. But while seeing these, you might understand the things. Okay, so, but when you are going for the 3+ years experience, the theoretical knowledge also would be compulsory as well as the practical knowledge. Okay, so please remember, if I'll give the one variable, you should in that position you should identify that variable. So what is this? Is it a topic or it's a timing or it's a qualifier or it's a rule variable? So these are the things. Okay, yeah, I'll not go one by one. Anyway, topic variable, you all aware that each and every domain will have one topic variable that will give the key information from that particular thing. Okay, so the timing and the qualifiers. Okay, so if you see these names, the name itself will have it's a definition. Okay. Can anyone tell for the role variable any example? Role variables. Yes. Sorry, someone said something I didn't get. Trial element start rule and yeah, trial element start rule and trial element end rule, trial with start rule. These are the things based on the rule. Okay. Okay, so again, these are types of qualifiers. So you might have heard that these qualifier variable again reclassified into the 5 more group. Okay, the grouping variable, result, and the synonym, record, and the variable. Okay, so if you see these are the things grouping, we can certain records we can group by based on the category, subcategory, these things. The results is directly said that based on the result. I mean, when we talk about the lab or ECG, any finding domains will have the results. Okay, those things. Okay. This synonym, just if you remember that some particular topic where we will have the decode and then modify treatment and terms will have, right? So these are the things comes under synonym variables. Okay. Okay, so the record qualifiers again, it's a position, location, and the particular spec. Okay, what is the spec? So while we are talking about the position and location, okay, some of the things captured from the particular body autonomy location. So what is that location, and then what is that position? Okay, so that also will captured. So those are all the record qualifiers. Okay, the variables again. The variable means if we have the any variable that is qualified. For example, results and the units. Okay, ORRES and then those units. Okay, so again units from the results. So these are the things with its variable qualifiers. Yeah. So this is a slide anyway. It's a general thing from the SDTM things. Okay, all these three classifications. Okay. So when we are talking of the intervention classes, okay, so we'll quickly check that. Okay, what I said that in the previous slides. Okay, if there are anything taken to the subject that we can call the interventions, right? Okay. So for that particular name of treatment, what would be the name of treatment? Which variable is that name of treatment? So we have a clinical trial. So in that particular, there are some XYZ that was taken to the subject. Okay, that will captured in the obviously in the CRF, the name of treatment. So this name of treatment comes under which variable? Can anyone tell? What is the topic variable in interventions? Yeah. So what is the name of treatment comes for? Topic variable, right? Topic variable and the TRT. Yeah. So these are the TRT. And then standard names comes under? Yeah, decode and then the synonym qualifier. Okay. So how much was taken means it's they're talking about the quantity dose, right? So what is the dose? And what type of classification dose is? Record qualifier. So the dose is it is talking about the particular amount, right? So that it for example we have 10. 10 means what? Generally I'm talking about. So we have some XYZ treatment and then when it was taken and in the result column we have the 10, for example. So 10 means there is no meaning for 10, right? It might be the 10 tablets, 10 mg, something 10 grams or something we didn't know. So when it comes to the dose and dose rate, then only it will meaningful things, right? So this is the record qualifier and the timing, obviously this is the timing would be the timing qualifier. Okay. Yeah. So basically, if you go for this level, for example, it's not about the SDTM. SDTM IG terminology bit different from the regular terminology. For example, if you are from the pharmacology or any pharmacy background, that is fine. Something you can correlate the things from your education. So you are from the BTech or MCA, MBA. So it's bit difficult those terms to understand, at least for initial. So okay. So when it comes to the clinical trial, the first thing you need to understand the CRF. So first of all, any new trial, simply you can open the CRF, go through for the 2 or 3 times. Generally, nothing you can do it. Just read and go. That's it. So after that, you'll aware that at least what is going to do in the clinical trial, you'll have some picture in your mind. Okay. So based on that, you can identify the things. Okay. So the again event also. What is happen means something will happen. So this question comes under the event topic variable. Term. Yeah, term. That's correct. So term is the which what is the role of term variable? Topic variable, right. And the standard name would be the again decode value. Okay, this is the synonym qualifier. Timing again it's the STDT and is severity fine. And then what it comes for? Record qualifier. What was the call fields? It's a record qualifier. Okay, the same thing from the findings as well. Okay, so for the finding also, again what examination was done. Okay, the category and then grouping qualifiers. Okay, so the category, the grouping qualifier means, for example, if you have some fever, when you go to the hospital, they simply write the complete blood picture. We don't know it's a malaria, typhoid, dengue. We don't know. So they'll simply write for the CBP. Okay, so the test in the CBP it will cover the many tests. It's not only just a blood count, RBC count or WBC count. There are many parameters in that. So these are comes under hematology, right? So these are the hematology category. So these are the grouping qualifiers. The category would be the hematology for that particular examinations. Okay. Test and test CD. This is the test CD is the topic variable for the particular finding domains. Okay. Okay. When it comes to the LB and then some MRI. Okay. For example, MRI or any particular CNS. Okay. Central nervous system related studies. Okay. These are the method would be required for the particular trials. Okay. So the which method you have performed those things. Okay. Those method also is important for those trials. Okay. So timing against a visit and DTC and then the time points. Okay, we used to have the time point variable, right? So we used to give some reference time points. Position. Yeah. So the what position it was taken. Okay. So the result against ORS, Western and Stress. Okay. Is there any clinical trial ORS and then Stress would be the same or different? In the trials. ORRES and stress would be the similar or different?
It's different, sir.
And always it would be the difference or only in few cases? Mhm. So the first of all, tell me what is the standard results and what is the original results?
Original means we collect it from CRF sheet.
Okay. And
Standards means we convert that original into according to specification. Keep converting
specification means, yeah, you said 100% correct, but the specification means what? How you can convert?
by converting factors, converting
Yeah,
formulas.
exactly, yeah. So by using the conversion factors, okay, that's absolutely correct. So, okay. So what are the results coming from the ECRF? Okay, what was the capture in the clinical trial? That is your original results. Okay. When it comes to the standard results, each and every results will have the, like SI units. Okay, these are we have the international standard units will have. So for the based on each and every parameter, we have some conversion factors. Okay, so by using those conversion factors, we will convert the results. So it means the CRF original things will captured under original results, and the standard results captured under standard results. Okay, but in the few cases, for when it comes to the questionnaires, okay, and then some of the things, for example, some results would be that it's not a numbers. For example, negative, positive, pregnancy test. In the pregnancy test, what we'll get is either positive or negative, right? So in that cases, there is no standard for that. Okay, those cases, the original and the standard would be the same. Okay, yeah. Okay. So again, these things which we just discussed about the, okay. So sorry. Yeah, identifiers. Okay, identifiers. Right? It identifies the things. Study name, domain, new subject ID. These are the things identify something. Okay. So someone will ask you what is your name, something like that. It's identify your identity, right? So those kind of things falls under identifiers. Okay. So which trial you are working? Some XYZ trial you are working means that is the identifier, obviously. So which domain you are working? Okay. Again, what is the particular unique subject? Okay. Subject identifier and the sequence also. Okay. So these are the things comes under identifiers. Again, that for each and every domain will have the one topic thing. So that a particular thing will comes under topic variable. 1 second. Yeah, just what we discussed, those are the things. It's not any new thing. You might all aware these things, but it's a refresh session. Okay. So again, the variable within the demographic, okay, subject level things, okay. Subject number comes under which? Subject ID. And then what is the subject ID? Which type of variable is this?
Identify.
Okay. In the DM, topic variable is subject ID or new subject ID? Subject ID. Okay. Okay, these are the things when did the subject start and then study treatment, RF STDTC, RF ENDTC, ICDTC, PSDTC. Okay? Yeah. I think you might all aware. What is the RF ENDTC? Can anyone tell? RF ENDTC. Treatment end date. So how you can derive the participation end date?
The last known date, follow-up date.
Last follow-up date. Okay.
Last contact known contact date.
Okay, for example, there's a trial. So we have the screening and then the 3 weeks of treatment and then the 6 months follow-up and the 12 months follow-up. Okay, then it's the end of the trial. Okay, after completing the trial, subject is having some rashes. Again, subject visit to the site and then for them, the principal investigator is treated and then for that, they enter the one record in the concomitant medication, one record in the adverse event. If something is given to the treatment related and then that will enter into something particular, any findings, okay. So in that case, your last visit would be the follow-up month 12. In that case, your last study disposition would be the last point of contact date. And then the later enter something for the few of the subject. So then how you can define as the RFP entities in that case? Someone is said from the call, it's a last point of contact date. That is the proper meaning. Okay. But when it comes to the last point of contact date, it's a fine, absolutely fine. But how you can derive the last point of contact date? You never know that particular date in the which domain?
We check AE data set, AE domain.
Sorry?
We check the results in AE domain, sir.
So for example, I'll have one subject, okay? For that each and every domain. In the questionnaires, we'll have the 2 lakh records and the LD will have the 1.5 records, 1.5 lakh. So these must use the data. How you can find which date is the maximum? You'll write for the each and every domain, each and every subject?
We can combine all the data sets and create one common variable for all the dates. By sorting the date, we can extract the last known contact.
So the basically, partially correct. Basically, what we can do is that in the trial, we'll take the assessment date only. It's not all about other dates which we are not consider. Only assessment dates we will consider. First of all, thing we should aware that what is the assessment date, what is the other dates. Okay. So the first we will list on the all assessment dates. Okay. Then you later you can write one macro. It will give the last point of contact date for the particular subject, each and every domain. So from there you can take the maximum date. Okay. So that is the last point of contact date from the particular participation ended. And then most of the people will tell that it's a last visit date and then the last dose of exposure, something like that. And in that case, what is the difference in the RFP and DTC, and then what is RFE and DTC? There is no difference, right? So we have a specific variable means there should be a specific requirement. So again, this is the characteristics everyone knows. Okay, this thing. Okay, so arm and term series you might aware everyone, right? So what is the arm?
Plan
Okay. So the what values comes under arm? Yeah, obviously drug name. That is apart from that. Apart from that, what values it comes under?
Screen.
Okay, screening. And then only screening? Or it's a
Screen failure.
yeah, screen failure.
Screen failure, not treated, not assigned.
Okay, what is the difference between not treated and not assigned?
Is not randomized, not assigned. After randomization, if not taken the drug, not treated.
Okay, yeah, that's correct. So what is the actual and what is the planned?
Plan is as per protocol.
Is there any
Actually, is what we.
is there any possibility that the actual and the plan would be the different and the same for the entire records?
Different, sometimes different.
Okay, 99% same and say only it's a treatment, or is there anything? Then what is the reason for the vary? So it's a clinical trial is a well organized trial, right? So how what is the chances to different?
And the subject is option for screening
Sorry,
or
sorry.
treatment.
So option means why? If it's option means what is the point? He'll come to the later and then that is unscheduled visit. He took the drug.
That value we taken in the atom study and atom.
The planned also same, right? If some subject is randomized to the drug A, then he's supposed to come today, and then due to the various reason he didn't came to the site, and then he came to the very next day and took the same subject. In that case, the arm and act arm would be different. Is it different? Sorry. Okay, the subject is randomized for the drug A. He's supposed to come to take drug today, morning 10 o'clock. Okay, so he come in the evening 5 o'clock. Obviously, it's unscheduled. Okay, so but he came in the 5 o'clock and I took the drug A. So in that case, the drug A and drug B would be different. So, sorry, actual arm and planned arm is different. No, we are not talking about the timing. We are talking about the arm and arm.
Maybe by mistake, if you plan to take A, we are
No, there is no different. We are talking about the drug and then the dummy. What he has randomized it, that only he took, right? So there is no difference in the arm and actual arm in that case. So those unscheduled visits is handled in a different way in the subject visits, and that how it is impacting the subject elements is a different story. Okay. Okay, again, this is the some specific variable roles. Okay, in the comments. Okay, when I said the comments, we used to have the couple of things. Okay, so one is for the domain level comments, and then some text from the particular domain or from the CRF page. Okay, so basically these things will populate and mapping under comments. Okay, so it depends. Sometimes what happen, how you can identify the domain level comments and the CRF level comments? Can anyone tell? I'll give the comment data set, SDTM comment data set. By seeing, you should identify which all are the comments from the domain level, which all are the comments from the CRF level. It's easy, right? what all are the variables comes under CO?
By seeing R domain variable, we can identify whether this is domain level or subject level.
Yeah, that's correct. So when you see the R domain variable, if it's a populated, it's a reference that is the domain level comments. If it's not, it's from the CRF comments. Okay. Okay, the subject elements. Okay, the element also again, it's a lengthy things to discuss. Okay, elements. The first of all, when we are talking about the elements, you should understand the clinical particular trial design. Okay, so the actual order of the elements. Okay, and then the start and time, and then subject level equation of the trial elements. Okay, we can identify easily the elements, but the thing is that when it comes to the subject level elements, that is the big challenge to trial and start rules and end rules, how we can find that. That is the important things. Okay, so that we will discuss in the that when we discuss or when we write a program for the subject element domain, I'll explain clearly. Okay, so again the subject visits, you know, right, the actual start and end dates for the particular each visit. Okay, we used to have the planned visit as well as the unplanned visits, okay, unscheduled visit. Okay, so what is the difference in trial visits and the subject visits? We have the trial visits and subject visits, right?
Trial visits is according to protocol we decide, and the subject visits is actual visits the subject has been attended.
Okay, yeah. So when we are talking about the trial visits, that's correct. It is planned under protocol. So in the protocol, which section you can find the trial, these visit related information?
Schedule of activities.
Sorry?
Schedule of activities.
Yeah, schedule of activities or schedule of assessment, these things we can find in the visits from protocol. Okay, this is the one more thing, subject, this is milestone SM. Okay, this is a timing, this is milestone for each subject. Okay, the subject level equivalent of trial, this is data sets. Okay, just it's a pictorial format of the SDTM 3.3 as a version. So what all comes under special purpose, interventions, events, study reference, and the finding about. Okay, so the trial designs, all these things. Okay, so when we create the finding about domain, FA, is there any specific example of when we will create the FA? Okay. Anyway, we'll discuss detail in the FA. No worries. There's a particular things in the to define the FA. When we can, the particular information is mapped to the FA. When we can. It means oncology studies only have the FA domain. By seeing the CRF, the particular form, what is the information you should identify the while doing the ACRF. Okay, annotated CRF, you should correlate the things. The particular form will have the finding domains as well as along with the finding about. So the based on that field you should identify. So that things I'll explain in the later in the ACRF while working on the ACRF things and then the FA domain programming. Okay. Again, this is the you might all aware, right? Is it required and expected and the permissible. Okay. So in the real time, if it's a required variable missing, what you can do? If it's a topic variable is missing in the particular domain, how you can handle it?
We will inform CDM department.
Okay, still it's not resolved then? Someone is said from that. What he can do with this data, statistician, is a SDTM. He did. Okay. Obviously, we'll inform to the data management. Later, after that, also it's not resolved. Then what you can do it? The topic variable is missing. Any domain, it's a missing. Topic variable is missing. Whether it's events or intervention or finding, okay, treatment or term or anything, it's a missing for the particular one subject. So the first thing, obviously, we'll log into the data issue log and then we'll inform to the data management team. But still, after that, also it's not resolved. What you can do it? Yeah, that first of all, what we can do, we'll log into the data issue log. Okay, again, okay, so the until database log. Okay, so there is a two options. Until database log, we can discuss with the sponsor that. So the so and so the required information missing from here. So we have already logged into the data issue log, but however, the data management team is communicating with the sites. Okay, so in that case, sponsor will have a two option. One is the topic variable missing record we can exclude, or else we'll keep it as it is and then populate until DBL. Okay, so obviously it will throw the error from the P21 validation. Okay, but after DBL, there is no option. The database is logged, still the information is missing. So in that case, there is no option for to do that. Okay. So in that case, there is a column in the issue of summary in the SDRG. Okay. When we are going to submit to the FDR PMDA, we need to prepare the SDRG, ADRG documents. Okay. So there are particular columns for these things. Okay. We need to issue the unresolved issues. Okay. And then data issues, any programmatical issues, if you did any sponsor specific things from that particular study. So these all are the things we can mention in the SDRG. So while preparing the SDRG, we will discuss each and everything. Okay. Yeah, again, it's a simple address event record. For that, you can identify the variables. Okay. So these all are the identifiers. Okay. Again, this is the required variables, right? Again, it's a topic variable. Again, required variable. So again, it's a timing variable, expected. Is the record qualifiers, here is the permissible. Okay. So again, permissible variable, we can drop it. Okay. But the thing is again depend on the, if the variable variable have the values, then we will keep it. Okay. So the until DBL, still we will keep these permissible variables. After DB also, the particular variables doesn't have any data. In that case, we will delete those variables post DBL. Okay. So those also permissible variable. For the required and the topic, if we don't have the data also, we should not drop those variables. Okay. So again, the supplementary qualifiers. So if there are any non-standard data and then extra data from any particular thing, so those will map into the supplementary qualifiers. Okay. So again, so for this, the control terminology and the series standards. Okay. Along with that, we'll have some sponsor specified things. Okay. Some of the few clinical trials and the few pharma companies, they'll follow their own standards. Okay. So that will, as I said, that is deviate from the series standards, but then still it is allowed from the FDA. So they have that much leverage from the particular things, particular trials and the pharma companies. Okay. So again, these are do not add the sponsor specified variables. Okay, defined in the particular trial. So do not rename or modify the existing variables in the SDTM standard variables. Okay. Do not impute that was not collected. So, you know, right, these are the SDTM, so we'll impute the thing, we should not impute the things. Okay. So again, these are the variable attributes. You might all aware the things from the SDTM IG. So these are the variable name should be less than or equal to 8 characters. Label would be the 40 characters. Okay. And then these are the series terminology, code list. Okay. For each and every trial, how we can follow the code list versions, and then where we can collect from the code list. While writing the specification, how we can incorporate this code list and everything in the specification level. So those we will more clearly discuss in the while working on the specification writing class. Okay. So this is the CDISC website. From here, you can download each and every SDTM and the RM, IG versions and the control terminology, everything. It's open source. Okay. Anyone create from their own account from the CDISC site, and then they can review the things as well as that they can attend some sessions as well. It's going on. So you can register and attend the sessions from here. Okay. CDISC organization. Okay. Yeah, that's it from today's session. So I know, it's a bit refresh session for everyone. So most of the members will already aware of these SDTM concepts from the basic level. So, but why we are planning this class is that it's not all about that we can go for the real-time work. So there are few members that might not aware of these things. So that's why we have refreshed the things. Okay. So the next coming 3 sessions and one more session also would be the kind of, the fundamental kind of thing you might aware. But the CRF annotation in the documentation class, the specification writing, that would be different. As well as after that, we are going to give the assignment. Okay, we'll give the blank CRF to you. You need to do the annotations, and then we'll give after that, we'll give the specification writing, and then we'll explain the things. We'll give the further specification writing, and then we'll give the protocol, and then we'll give something from the protocol what you have understand. You need to write it the things. Okay. So if you've done these exercises, while invalidly you'll get some clear picture on the particular trials. Okay. So that's it from from my side today's session. So is there any question or concerns from anybody? Of the initial study, when it awarded for any particular CRO, the study, so the initial will have the kickoff meeting. The kickoff meeting is to attend only the project managers, okay, as well as the statistical lead, and then the statistical lead programmer, as well as the project management team. So these people will attend the kickoff meeting. So from there itself, they'll discuss the CRF design and the protocol design and everything. So everything is finalized, and then the statistician will write the SAP. So after that, CRF design is finalized, and the site level entry would become, and then this picture already. So data will enter in the site and everything. So from our part, we'll start from the ACRF annotation. Okay. So when it comes to the new trial, first of all, we'll do the CRF annotation, and then the later trial domains and the SDM specification. Okay. So the programming, and then the later checks and everything. The programming flow I'll tell you in the later. Okay.
Yeah, hi guys.
Hi, Rendra. You can continue.
Yeah, fine. Sure. Yeah. Yeah, guys. So this is about us like a brief introduction class about this like real-time project. So day by day we'll increase the topics and all. And from tomorrow onwards, guys, we plan to start the batch from like morning session, like 9 a.m. to 10 a.m. Is it fine for you guys? All of them? 9 a.m. to 10 a.m. is fine for you?
Yes.
Guys, 9 a.m. to 10 a.m. is fine for you? All of them?
Yeah, fine, sir.